Hello, everyone. A very warm welcome to all of you today at the launch of Eclectica, the different news. Well, I am Dr. Gargi Roy Goswami hosting this show, and today I have with me Dr. Bagavad Gita. But before calling in Dr. Gita, I will just tell you two lines. What is Eclectica? So, Eclectica is a voluntary endeavor where we will bring up experts from different fields of science, technology, healthcare, marketing, finance, digital platforms, and also more interesting entrepreneurial stories to in front of you. So, not wasting much time, I would first, introduce today's guest, Dr. Bhagavad Gita. She is a professor and head of the Department of Periodontology at Sree Balaji Dental College, Chennai. Teaching and clinical practice since 25 years. Ma'am is MDS in periodontology as well as she has completed her PhD from University of Madras, and she has many peer-reviewed publication in national and international journals. She has been a reviewer in many specialty journals, and her main focus of research is oral systemic health. Not only that, she has in her bag of accolades many book chapters and books uh, mentioning the two most important ones as periodontal disease effect on cardiovascular disease and preterm low birth weight, as well as our lipid profiles two biomarkers in periodontitis patients. So, with that, I welcome ma'am. Hello, ma'am. Thank you for joining me today at Eclectica and at this live session of the launch of this program. And thank you always for encouraging me and supporting me in all my endeavors. So, first question is, how are you?
Hi, Dr. Gargi. It's a real pleasure meeting you as well as everybody who's viewing me on this platform. I think it's really a wonderful initiative of yours, this Eclectica, and wish you all the very best for it. I'm sure it's going to go great. Yeah, I think just like all of anybody, everybody else watching this and you, I'm sitting inside. But probably I should say, as a dentist, I'm contemplating a lot more as to how this virus is going to take a turn and how it's going to impact practice and how we are really going to take care of the oral health of the people around us. Because as of now, we are just into emergencies. So we don't know for how
Right.
long we can really keep away dental diseases at bay. Let's see. So anyway, I think I should really thank you for putting me onto this platform because I've
Thank you,
spoken a
ma'am.
lot on scientific platforms and probably a little non-dental, but still some kind of oral health platforms. But this is something really different to me because I'm speaking to a varied range of people, so who may not have a clue about the technical jargon I'm talking. So I'm going to keep it very simple so that it could be understood
Absolutely.
by everybody. So
Yes, ma'am.
basically, it was a very kind introduction you had given. I am a
Thank you,
gum
ma'am.
specialist. Actually, to put it in a very
Yeah.
simple words, I'm a gum specialist. So people who come to me normally they come with complaints like bleeding gums and shaky teeth. So those are the kind of course, there are a lot more. I even treat cosmetic diseases of the gums to make them look better, and so it's a whole lot of things which I'm not going into now. But and also, of course, as you had rightly mentioned, I'm a true blue academician. Besides treating patients, my biggest passion is teaching. So as I was going down the line, I always had the advantage of getting updated with the latest in my field because it was also helping me to understand the subject better. At the same time, I think I was able to give a good treatment to the patients. But one thing I understood, and like all of us understand, is that periodontal disease is a very prevalent disease, and it's very
Absolutely.
difficult. It's very difficult to treat when you come in the last moment. And another big uh, catching point there is that the patient rarely has any big complaints. So by the time they come to you with a gum disease, they are probably going towards removal of the tooth. So all along these years, and healthcare costs are very expensive. If you want to treat gum disease in an advanced stage, or you want to remove the tooth and place another replacement, it's extremely expensive. So I
True.
was always my journey down this thought I should think more on terms of prevention of the condition. It's actually globally the sixth most prevalent disease. So I thought, so that set me on thinking on the path of research. I thought we should do something. Social responsibility for me is not only to treat, but also to prevent. So that is what
Right.
put me on my path of research. And so here I am donning the cap of a researcher, academician, as well as a clinical periodontist.
Yes, ma'am. That actually, your when I was just introducing you, I understood that you are almost 25 years in the profession, absolutely as an academician, and you are also a dental professional as a practitioner. So my one question is that's running in my mind is that many times even I speak of importance of research, but what do you think? What is your perspective regarding whether the clinical aspects and research, particularly in dental, I'm talking about, should go hand in hand, or it should be kind of separate, or how things of affairs or state of affairs are right now prevalent generally? So I would like to know from you, and also our viewers will be getting enlightened from your perspective.
Yeah, I think that's really a very, very vital question which you have put across to me because I definitely feel that not only as a gum specialist, as a dentist, as an oral healthcare provider, I feel that one thing which we really need to look at is if your oral health is impacting your general health. So that is something which is sadly happening, but there's a very poor understanding of this. Sometimes I would say even among oral healthcare providers, namely dentists, and definitely among the medical professionals, medical practitioners, they really don't understand that the oral health can impact the general health. And probably this set me thinking, and to be very explicit, as you said, my passion or my focus or my domain of research is only oral and general health. So I finished my PhD quite recently, and I should say that my focus of research has been how your oral health can impact your heart health. So we call it as
Okay.
cardiovascular disease. And I think everybody will know when you talk about a heart attack. So it is something which is very
Right.
morbid and it can entirely ruin your life. Even if you come out of it or you don't, it's definitely going to be something very difficult to handle,
Yeah.
both from the economic point of view as well as the moral point of view and everything. So my lot of studies were saying that it was connected to heart diseases, and ultimately it has been proved. But as a scientist and as a researcher, and also as a well-wisher for the society, I felt that we should understand why this is happening, how this is happening. Only then we can prevent it. So I've just started just a small contribution of mine to the society. I have found a new molecule,
Oh, that's fantastic.
yeah, which could, it's of course in a very initial stage, but I have definitely found a molecule which could bear a relationship to oral health, poor oral health causing heart attacks. That is something which I'm working on, and I hope in the near future I would definitely come forward with some treatment which could prevent heart attacks in people with poor oral health. So that is something I really want to speak about and make people understand. So there are people who are listening to me out there, please get your oral health checked. If not only for saving your teeth, it's for saving your heart as well as keeping other diseases like diabetes and probably even hypertension, which is so common. All these things are all
Correct.
interlinked. I want to take this platform to request people to understand this also.
So, ma'am, okay, before that, before bombarding my next question to you, I would request all the viewers, because I see some people are watching us. So, can you just introduce yourselves in the just post about yourself, so that we also get some encouragement, and it's like more of a conversation. This is not a webinar, all right. So, I think informal chats are much required to keep us motivated in this grave
Yes,
situation.
definitely.
Okay, ma'am. Yeah. Okay, ma'am. So, Yeah. Ma'am, actually, as you were telling about this heart attack or the cardiovascular disease and relations with oral health, even commonly we when we read things or when we are taught in dental school, we are generally aware of this, that okay, there is some link with the oral systemic link, but I mean, how important is it, according to you? How important is it to actually give stress on this factor? Because as far as my knowledge and experience goes, even we really put this aspect of oral systemic link into practice? uh, I mean, I haven't seen much of that. So I would like you to tell, being an expert in this field, I would like you to tell about the importance of oral systemic link.
Yeah, yeah, that is actually something which I always wanted to perpetuate to my younger dentists, the dental aspirants, and maybe even the practicing dentists who are not aware of this. I always used to feel, and I always used to insist. I think even if any of my students are listening, look at the patient as a whole. So it's not the 32 teeth which you're going to drill and fill or do a cleaning or make the patient look good with your good dentures or whatever. First of all, the patient is having an entire system related to him. So the oral cavity, it is related to the nasal cavity, the respiratory system, and the gut and everything. So look at the patient as a whole first. Take a proper medical history. Find out if he has any allergies, if he's taking any medications. So that would be the first step I think we should take in understanding this oral systemic link. Look at the patient as a whole. So don't look at him as somebody who's just needs a filling or a scaling, or somebody who just has an oral problem. And secondly, as I already told you, healthcare costs are soaring in for not only for your oral procedures which are delayed and which are very advanced, but also the healthcare costs for systemic diseases. You know how much it is for maintenance of a diabetic patient all through their lifetime, and also for a patient
Absolutely.
who's going to have probably a heart attack. Definitely it's a lifelong package of medicines and continuous checkups, and
Absolutely.
probably even if you're having a stent placed, I think we all know that every 3 years you have to get it checked. So it's not very
Correct.
easy. So I think it's much more easy if you're going to prevent things. And the
Right.
more important thing is when that responsibility lies with you and you're not aware of it, it's really sad. Because as an oral health provider, I have diagnosed cases of leukemia, I have diagnosed people with diabetes. I think probably every other day we diagnose diabetes in patients who are
Right.
not aware of it. So I think this
Correct.
awareness, and probably I would, as we always used to keep speaking, I think this should become an integral part of the dental curriculum, that this oral
Absolutely.
disease and systemic disease have to be interlinked. And
Right.
probably I am doing my little bit on social media also. I think you are
Yes.
a great inspirer to me from that point of view. But I think this
Thank
has to
you.
reach the public. But before that, I think if the service providers are not aware of it, it's not something which is going to work out in a big way. Because I think the medical practitioners and the general dental practitioners should first be aware of this. Only when
Right.
they put their foot forward and they're going to educate the patients who come to them, it's going to help in the long run. So I feel that a good oral health is definitely going to maintain the overall health of the patient and the well-being. And also, I think they will keep their purse strings intact. There's a lot of aspects to this. And one more thing
Yes,
I would
ma'am.
probably like to add is that the gum diseases, they don't stand alone. They take a big risk with them. So it's not only these conditions. So you may be genetically predisposed to developing
Yes.
gum diseases. An obese patient has a high risk. A smoker
All
has
right.
an extremely high risk of developing gum disease. And so when you're at a risk of developing gum disease, and in the bargain you're at a risk of developing other more serious diseases, I think it makes sense to just get your teeth checked frequently and get your cleaning done regularly and maintain good oral health. That's what I would like to say to the public at large, and also, of course, to practicing dentists and other doctors.
Yeah, I think that's a wonderful perspective that we got from you, because I think putting into things into practice. Firstly, as professionals, as general dentists, we need to become aware of it, and we should also understand how to implement these simple things into our practice. Maybe it will just take 2 or 3 minutes more of our talking to the patient. Nothing much more than that. So okay, ma'am, it was wonderful actually talking to you. So just coming to the concluding part, so I would like to know that what message do you have for our viewers? Because I think through this platform we have many viewers, and a versatile crowd, not only dental professionals but common people, as well as students who look up to you, practitioners who look up to you. So I think we will be wanting to know your message for us through Eclectica.
Yeah, the of course, firstly, I've already touched upon the main things that I have to say. What I would like to say, one thing to the public maybe, and then also to the future dentists who are going to actually be the backbone of dentistry, maybe the next many years to come. So as I look at dentistry as a science, because I see many people just looking at it as a practicing tool. Because see, I have to be very honest with this. Even though I'm a dentist and it is my living, dentistry is something which can be managed for some time without treatment. You know, like what we are going through now is a very example of that. You know, like you can
Right.
take medicines and you can manage it. And lot of dentistry is cosmetic. I think we all agree with that. So definitely,
Right.
without the filling, a person can pull along for quite some time. Maybe
Hmm.
about 2 or 3% of the cases are going to be emergencies, and we'll really have to take care. So let us focus on dentistry as a science. I feel it's dying. So I may sound like an old timer and an old school of thought, but I think it is true. Old is gold in this point of view for sure. So I think that because it's
Absolutely.
time and again it's being proven, the very fact that poor oral health is causing a lot of diseases is a, I think, proof enough for that. So that is one thing I would want all practicing dentists, aspiring dentists to be, everybody to keep in mind is look at it as a science first. So see what is the disease and what is happening and treat the patient as a whole. And probably to the general public who's viewing this, I would say please understand the importance of oral health. Definitely,
Yes.
I know it is something which doesn't bother you too much. If you skip your dentist appointment, which is scheduled, an elective appointment, it's not going to really hurt you in the near future. But don't postpone it for too long. It's been really well proven that people who regularly visit their dentists and who have their annual checkups and their prophylactic treatment done regularly are definitely at a lesser risk from developing other conditions also, like diabetes and heart diseases, and even poor oral health is associated with even problems associated with pregnancy, like preterm, low birth weight delivery. So these are all things which are proven. So I'm not talking something out of the box. It is all things
Right.
which are happening, but I feel the awareness is not there. That is what I would want to propagate during this talk. Please visit your dentist annually and keep your oral health good. That's what I would say. That
Thank
is,
you, ma'am. Thank you once again for all your perspectives and insight. And we are all enlightened. And I think in future we will have more learning sessions from you through Eclectica, and more conversations on different aspects of dentistry and dental research. So thank you once again for joining me. And I will again contact you for such wonderful session. Thank you so much.
I think I should thank you myself first because I've been waiting for a platform like this where I could interact with a variety of people and make them understand from their perspective about the importance between oral and general health. And it would be really wonderful for me to interact further with you on different platforms. Thank you so much and good luck with your Eclectica and all your endeavors.
Thank you, ma'am. Okay, that was Dr. Bhagavad Gita, and thank you all of you for joining at this little bit post dinner time. And it's a inspiration for me and also for our guest today. And well, this Eclectica journey will continue, and If you have any questions to ma'am, or any of the topic that you want to ask which is related to gums, gum disease, or periodontology, so you can put them in the comment, uh, in the below this video in the comments, so that we can definitely go back and address them and try to answer them as soon as possible. So please do not forget to subscribe this channel, so that you become aware when we again come with something, some more expert in some, with some fascinating area, with some fascinating news. So thank you once again, and that was wonderful with Dr. Bhagavad Gita. And stay safe, stay well, be positive, and we will all overcome this grave situation. Just don't worry. So I am here waiting for you guys again to come back in another episode of Eclectica. Till then, bye bye and good night.